Mr. Vimlendu Jha, who's an environmental activist, Dr. Parthiv Sanghvi, who's a senior pulmonologist, and Abhinandita Mathur, who's the spokesperson of the Aam Aadmi Party, who will also join us on the broadcast in just a few minutes from now. I want to come to you, Dr. Sanghvi, first, because this is a larger health emergency, a situation that we are facing right now. Tell us, what does this severe AQI really means for each of us who's breathing this air? And more importantly, for the children living in the Delhi NCR region, because various reports would tell us that it's the children who are the worst affected in the immediate and in the long run.
Yeah, hi, good evening, and thanks for inviting me to the show.
Yes.
Now, AQI, if we were to elaborate, is air quality index. And air quality index is shown at various parts of the city on a day-to-day basis, which tells us what is the quality of air, whether the pollutants which are present in air as a result of the vehicular smoke and other pollutants is crossing the deadly limit or not. So that is why you might have seen at prominent locations there are signboards which tell you on a day-to-day basis about the air quality. Now, on a routine in metro cities like say Mumbai or Delhi or other cities, we have a lot of pollution as regards to factories or vehicles which are plying on the roads. And especially the smoke which emanates from the vehicles is one of the bigger factors for polluting the air. Now, in the problem comes basically in the winter season, because in the winter season we do not, the air quality, it basically thickens, and there is not much of movement. Now, at such points of time, when we have smoke blowing from other regions coming into our city or our air, it adds to the pollution.
And Dr. Sanghvi, I'm sorry I'm interrupting you, but because this is because of the paucity of time we have, can you also tell us about the health implications it has?
Precisely. So that's what I was coming at. So usually on an average, in a city like Mumbai or Delhi, it's like, have smoking around 10 to 15 cigarettes a day when you are walking on the roads on a day-to-day basis. But when all this stubble burning smoke comes, it is, calculating, if you were to calculate, it would go beyond 30 to 40 cigarettes a day, smoking in this. And now the biggest problem is, rising respiratory problems like asthma. Asthma is one of the biggest problems.
And sir, on that note, I want to bring in our political guest as well into the discussion. Asthma, breathing difficulties, each time multiple allergies that me and my family members face because of the rising pollution. If you have somebody at home who has diabetes or a heart condition, it becomes far worse for them. We have with us on the broadcast Mr. Rajiv Babbar as well. And we have Siddharth Sharma from the Aam Aadmi Party who's with us on the broadcast. Siddharth, I'm coming to you first. Is the statement coming in from the Punjab Agriculture Minister really defensible?
I've lost your audio.
Can you hear me, sir? Am I audible to you?
I've lost your audio.
All right, we'll just try and fix that. Meanwhile, Rajiv ji, I'll come to you. Help us understand, how do you see this entire situation? I mean, you can raise a lot of questions on the Aam Aadmi Party, and we are raising too, but the government of Haryana also needs to be held accountable. The air pollution or the air we breathe right now do not respect the state borders. It affects all of us equally.
No, I totally agree. The Delhi's problem actually is because, unfortunately, it is like this, that, you have a big organization, and in big organization, you need a full-time CEO. In Delhi, unfortunately, we have part-time chief minister who is not interested in Delhi, who is actually busy in roaming here and there. And that's the problem. He is not able to focus because his aspiration to become a national leader is more than the life of Delhi people. That's actually the real problem, because the government is in power from last 8 years. Every time, every winter, the same issue. Now this time, they have a problem, because in last 7 years, if you see the television debates, they were blaming Punjab for the Parali burning. But this time they are in problem because they cannot do it, because they have their government there. So the point is the real action. I'm not blaming, but first of all, I want to tell you what kind of real action are actually in Delhi. I'll give you one example. Center government invested more than 60,000 crores. They have made this eastern periphery, western periphery. Now 60,000 trucks every day are going outside Delhi. Those who were making Delhi a polluted city. This is a real kind of effort which central government has done. If you have seen
Mr. Babar, I'm interrupting you because this is an issue which encompasses a lot of things. And you're right when you say that when the union government spends a lot of money in building the state-of-the-art infrastructure, you are helping the cause of, having a cleaner air in the long run for all of us. But that's not the point on which I am right now. I am talking something very specific today. Delhi, for most part of the year, has a bad air quality. That's a given, right? It's only during this season after Diwali, when there is stubble burning, it gets very difficult for all of us to survive. We suffer. Right now, we are addressing the issue of stubble burning. Stubble burning happens in Punjab and in Haryana. Would you want to speak from the side of Haryana? What has the government done to reduce stubble burning in that state?
See what happened in last year also, when this complaints were there. Haryana government took very serious action, and we have actually, issued a satellite picture last year, which was showing the effort of Haryana government. The same kind of efforts are done by Haryana government even today. And I am not saying that, we have to blame only a Punjab government because there is a Aam Aadmi Party. I'm saying that all the states have, they all have become responsible for other states, because it's actually, life of everybody is important. So I am not defending any state, but I'm saying the effort which Haryana is doing, which they did last year, that has resulted, in good numbers as far as results is concerned. But Punjab,
I'll bring in Vimlendu on that point. Before I go to the Aam Aadmi Party spokesperson, we have callers who are reaching out to us. Dr. Mahapatra from Cuttack, Odisha is with us on the broadcast. Dr. Mahapatra, tell us, what do you think?
I think actually the central government should bring a law, enact a law, so that the stubble burning is completely banned. And the state should be made to pay for the pollution or the environmental pollution they are doing over the Delhi. This should be a central law enacted and implemented. And financial punishment should be made both on Haryana and Punjab.
Sir, something on these lines was actually thought about. It was actually thought about, but it was never really implemented for various reasons. Mr. S.K. Sharma from Jaipur is calling us. Mr. Sharma, tell us what you think.
मैम, कैन आई स्पीक इन हिंदी?
जी सर, बिल्कुल, बोलिए आप।
मैं ये कहना चाह रहा हूँ कि ये जो इश्यू है ना, ये इश्यू एक्चुअल में क्या है कि जो पीड़ित है ना, वो ही जान सकते हैं। इसकी जो पीड़ा है ना, वो पीड़ित जिनके घर में जो सफर कर रहे हैं, जो जिनके घर में बीमार हैं। बाकी ये जो एसी और जो एयर प्यूरिफायर में बैठने वाले और टीवी पे डिबेट करने वाले, ये तो केवल एक डिबेट की चीज हो गई इनके लिए। एक्चुअल में सुप्रीम कोर्ट भी कुछ कर नहीं रहा है। और जो अभी डॉक्टर साहब जो कटक से बोल रहे थे, जो उन्होंने कहा इस पे लॉ लाना चाहिए जी, तो मैं उस बात पे उस पे भी सहमत हूँ, और उनकी राय में मेरी राय है। मैं एक अलग से ये जानना चाह रहा हूँ, डॉक्टर साहब जो ये पल्मोनोलॉजिस्ट बैठे हैं जी, मैं इन सर से ये कहना चाह रहा हूँ कि ऐसी कंडीशन के अंदर, क्योंकि अब आम आदमी तो बेचारा हो गया, बेसहारा हो गया, वो तो देख रहा है, वो तो पीड़ित है और वो तो उसका शोषण हो रहा है। तो ऐसे में डॉक्टर साहब ये जो एयर प्यूरिफायर का इसमें कितना क्या रोल है, कुछ ये थोड़ा सजेस्ट करें तो आदमी 10-5 हज़ार रुपए लगा के कम से कम दवाइयों से तो बच सकता है ना।
नहीं शर्मा साहब, मैं ये सवाल आपका जरूर लूंगी डॉक्टर साहब से, और आपको इसका जवाब भी जरूर दूंगी। और